Breathing patterns. Breathing is a complex process that relies heavily on the coordinated action of the muscles of respiration and the control center in the brain. The respiratory rate is the rate at which breathing occurs. It is set and controlled by the respiratory center of the brain. A person's respiratory rate is usually measured in breaths per minute. A physiological change can be one of the first signs of deterioration. Respiratory terminology. Apnea means normal, unlabored breathing. Bradypnea means a respiratory rate less than 12 breaths per minute. Tachypnea is a resp rate more than 12 breaths per minute. Apnea is the absence of spontaneous breathing. Dyspnea is a term that refers to shortness of breath or difficulty breathing perceived by the patient. Biot's breathing. Biot's respirations are also known as ataxic, as there are periods of apnea. Is caused by damage to the medulla oblongata and pons due to trauma, stroke, opioid use, and increased intracranial pressure due to uncoil or tentorial herniation. Often this condition is also associated with meningitis. Kussmaul's breathing. This is an abnormal breathing pattern characterized by rapid, deep breathing at a consistent pace. It's a form of hyperventilation. It's usually a sign of metabolic acidosis when there's too much acid in your bloodstream, related to DKA. Cheyne-Stokes breathing. This is an abnormal breathing pattern characterized by periods of rapid breathing followed by periods of no breathing. The primary cause is instability in the brain's feedback loop that chemically regulates breathing. Common causes include heart failure, especially in the elderly, strokes, as up to 20% of strokes can experience this breathing, brain injury, high-altitude sickness, excessive bleeding, tumor, or a person reaching end of life.